All right, chapter 38 in your textbook, assisting in physical examinations. So it's the first step that you'll do when a patient comes in complaining about their chief complaint. You're going to look at the whole body anyways, and you'll do your vitals. The doctor will take a look at the whole body, and then the doctor will go system by system, right? Evaluation of the systems. So purpose, baseline, very important. For example, blood pressure. So it's very important that we know what is your normal blood pressure. Because if we don't know what your normal blood pressure values are, how do we know if now you suddenly have high blood pressure or lower than normal, right? All of your lab values, right? All the things we look for in your blood, if we don't know the normal values, how do we know if it's off? And definitely, if a lab value is out of spec, for example, sugar, what should your sugar, your resting blood sugar be? What's the goal for diabetics? Do you guys know? 120? 180? 120? 180? All right, those numbers are in there. All right, so on the low end, you want to stay closer to the low end. And this is when you're not eating at all times. You want to be around 80, below 100. After you eat, yeah, it's going to go up a little bit. But when we tell you to fast at 12 midnight and we give you that morning appointment, we want to make sure it's down there. If it's a little bit high, we're going to do further tests. Signs versus symptoms. So which ones can be measured?
Can be measured?
Yeah, which ones can be?
Subjective.
Cannot
be or can be?
Measured.
Subjective.
That can be measured.
Oh.
Yeah, so just remember this. That's subjective to interpretation, right?
Okay.
So whose interpretation? Depending on whose eyes are looking at it, right? She's pretty. No, she isn't. She's ugly. So it's subjected to interpretation. However, if it's objective data, I can measure it, right? I can measure your height, your rate, your respiration rate, your weight. So the patient will come in with signs or symptoms. What will they complain of? Yeah, so I got pain. I can't measure your pain. You're just going to tell me relatively 0 to 10. It's not really a good measure because pain is all relative. Other things we do, differential diagnosis. Okay, you got a bunch of symptoms, but it could be this disease or that disease. So how can we tell them apart? So we might run some further testing to differentiate between those two. Prognosis, progress, right? So if we want to see how your cancer's doing, right, we'll take an x-ray and we'll look at the size of it. And then if it's still there, guess what we're going to do? We're going to plan our next treatment, right? So we give you another cycle of chemo, we check the size again, and if it's still there, another round of chemo. We plan further treatment until it's gone. Assisting. All right, so most important thing is patient education. So if the patient know what's going on, or what's going to happen, then their anxiety is going to be reduced. So if you've been going to the same doctor's office, most likely all the procedures are the same. You already know what to do. The receptionist is going to get you in, they're going to call your name, you're going to wait there, they're going to do their vitals, and then 2 minutes later, doctor will come in. Every year, it's like that. You know what to expect, and you feel more comfortable. So take the interview, as we mentioned last week, correct history, including the family history, and then the vital signs, height and weight. So that's the MA's role, just to get that started. And you may do an overall general Assessment of the patient, like patient seems sleepy, you can document that. That's perfectly fine. Make sure everything's available. Supplies are restocked as needed. One thing the patient might need to do is to change out of their clothes and into an exam gown. So where do they usually change?
In the room.
Yeah, so change in the room, or you can have them go to the bathroom, right? And if they're going to the bathroom, you can ask them to give them a sample, a urine sample, since they're going to be in the bathroom anyways. So you can kill two birds with one stone. If they need help, assist as needed. Always remember your standard and universal precautions. So protect from infection. Open skin, unintact skin, put gloves. Aseptic hand washing. So when you're rinsing, fingers up or fingers down? Down. If it is a surgical scrub after you wash your hands, fingers up or fingers down? Fingers up, right? Because you're going to clean past your elbows when you're doing a surgical scrub. When you're doing an aseptic or medical scrub, it's just up to your forearm, right? Blood, bodily fluids, definitely wear gloves. Intact skin and moist membranes, usually where there's mucous membranes. You need a cough. What should you cough into?
Your forearm.
The bend of your elbow? So it used to be cough in your hands, right? Cover your mouth. And the first thing you do is cover your mouth. But as soon as you uncover your mouth, what do you do with your hands?
Said something.
How long can the flu virus live?
2 weeks.
2 weeks, yeah. So on a surface, so you're spreading it everywhere. Better have tissue around. Cough into the tissue and then just toss that tissue away. If it's droplet precaution, droplet infection, if you're going to be coming in within 3 feet of the patient, put on a mask. If it is particulate, particles in the air, then you need a respirator. Right. So the exam mask, that's the one that accordion folds. A respirator is a rigid one, and you have to test it for a seal. Red. What's usually red?
Hazard.
What kind of hazard?
Hazard waste.
Hazard waste. What kind of hazardous waste? Glass? That's hazardous. Chemicals? Biohazard, right?
Oh, yeah.
So biohazard.
Bio.
So that red. Biohazard. Only if it's infectious or might be infectious, right? Okay, so I got a trash can. You gave someone a flu shot and a little drop of blood. You took the gauze. You wipe the blood. Does it go in regular trash or does it go in biohazard?
Biohazard.
Biohazard?
Yeah.
Trash? Which one is it?
Biohazard.
Trash.
What?
On, it's what?
It's a little bit.
Yeah, only if it's little. Only if this is
Oh, like
dripping,
Yeah. Oh, okay.
soaked with blood, then it's in the biohazard, right? And that's because it's going to dry most likely. Any infectious agents are not going to be living after that. But if it's soaking, they're going to be living for a while until it dries up. Clean, disinfect, sanitize. So sanitize, lower the microbial count. So if you can see blood, you better wipe off the blood, right, on the instrument. If there's skin on the instrument, wipe off the skin. If there's hair, wipe off the hair, right? So that's just cleaning. Hot water, cold water, warm water. What should you use? Definitely cold water. Because hot water might cause the cells to break apart and then attach to the instrument. Disinfecting, we're going to bring down the microbial count even more. The most important thing is contact time. So, same with your alcohol hand sanitizer. You're supposed to get your hands wet, and then you're supposed to let it dry naturally. If you wipe it off, or continue to wipe your hands until they dry, it's not working properly. And then lastly, using specialized machine and indicators of sterilization, you got the autoclave. Explain the patient the procedure before. Like I said, it will reduce any anxiety. Male, patient, female, assistant. Who needs else to be in a room? Yeah. So it's usually the other way around. When there is a female patient and a male doctor, you'll usually have a female medical assistant or another female, the family member in the room, right? So that's one of the things we want to do to make them comfortable. Disrobing, help them if you need to. And then cultures are always different. So just don't make any assumptions. Some cultures, they're very prudish. Give me an example. That they cover their body. Not even allowed. Yeah, so that's one. Other cultures, yeah, they're very modest. Other cultures, very open, right? The French, go to the beach, everyone's topless. Right? Go to Black's Beach here, everyone's topless. Right? So don't make any assumption. And then from culture to culture as well, they got a lot of differences on modesty. Positioning and draping. Draping is for modesty and for warmth, right? I'm half naked, you better put something over me or I'm not going to be comfortable anymore. Right? So put them in the correct position and then cover their embarrassing parts. Right? Might not be embarrassing to you, but don't make any assumptions. Sitting, easy enough. This allows for access to the patient's head, upper body. Easy enough. And access for the doctor all the way around. Supine, because they are on their spine. Right? But for some people, it's hard for them to breathe if they're flat on their back. So what we'll do is we'll raise up the head position a little bit. So they'll call that dorsal recumbent. They're still on their spine. So I wouldn't fault you if you said supine. 100% or 110% dorsal recumbent. This is for flexibility. So those with arthritis and can't lay completely flat, then it might be more comfortable for them with their knees up. Fowler, also a good position for shortness of breath. Puts less weight and pressure on the lungs itself. Lithotripsy, actually you should be positioning the patient closer to the edge of the table. That way the doctor, they'll be on a stool and they'll have better access. So what's a lith? Stones, right? So if you have kidney stones, it's more kidney stones. Gallstones, you have to get up to the liver. Prone. So access the back, musculoskeletal system. Sims, this is the preferred position for suppositories. Right? So most patients are right-handed. So have them sit on their, or lay on their left side, put their right knee up, and they're right-handed, they can reach around and then insert the suppository easier. Unwrap and insert. Fenestrated drape. This is the obviously knee elbow position. Fenestrated means, what does that mean to be fenestrated? There's a hole, right? So instead of pulling all the way up a corner to access the rectal area, there's going to be a slit. and then you can just access the area from there. That's what fenestrated means.
It has to be embarrassing.
Proctologic, yeah, that's why you have to explain to them the position, what they're gonna do, what this is, right? Are you warm? Do you need a blankie? Need to hold my hand. So cultural difference. One example is during World War II, the Japanese that were interned, right? The Japanese concentration camps. They're super modest, but they didn't have like a lot of privacy in the bathrooms. They set them up just like gym style. So the showers were open, the toilets were all open, and what the women did was, well, they all walked around with paper bags over their heads. They just covered themselves. So when you look down, there's no eye holes. When you look down, all you see was like from the knee down. So that's how they overcame their modesty problem. So just don't make any judgment. Just assume everyone's super modest. Lift with your back? Knees? No.
I mean legs. Legs.
Lift with your legs. So very important to prevent injury. Get help if you need to.
Yes.
And if you have to, use the strap. Have you guys taken the nursing NMA? So you guys all know the procedures, exactly how to position yourself. Don't use your back, use your legs. Those are the strongest ones, the largest ones in your body. All right, different types of inspection. So we can look, we can touch, we can feel, we can hear. So we have specific names for them. So visual inspection, all the things we can detect. Uh, acoustic. What is acoustic? Aku.
Hearing.
Yeah, sound. So here we're going to listen, and as we learned, there are two listening areas to the stethoscope, and you have to tell the stethoscope which side you're listening in to turn it on. So for low frequency sounds, we'll use the diaphragm, and for higher, we'll use the bell. Palpitation. So that's with touching. So you'll feel for texture, firmness, temperature, vibration. Percussion, here we're making sound. So percussion instruments, we're actually banging. So drums are percussion, a piano, we're banging on the piano string. So we're tapping with our hands and listening at the same time. So for example, lungs, right? Should they have a hollow sound or a dense sound?
Tense.
What are your lungs mostly filled with? Air. So should it have a hollow sound or a dense? Should have a pretty hollow sound, right? So when you hear a dense sound, then it might be filled with fluid, thick mucus accumulation. 50-50, not a bad. Better than Vegas odds. Measuration. So here it's not the menses they're talking about. It's just the process of measuring. So weight, height, circumference, and then manipulation. They'll move your joints and arms at all different angles just to check if there's any problems, any clicking, any grinding. Right, general appearance. So that's the overall, and then specific body sections, and then the organ systems as well. So be familiar. You'll be helping. Have you guys assisted before? No. In a procedure, medical procedure. Some students have experience, and they're just back for the degree. So we talked about all the equipment last week in chapter 37. And then additional items, stress, pain, skin color, the nails. So if you ever seen a cancer patient who's gone through cycles of chemo, their nails will be rigid on the surface of their hand. Right? And that's because when they're on chemo, poor nutrition, the nails are poor, they're thin. And then when they're off the cycle, they have good nutrition and the nails grow nice and healthy again. So we can trace back maybe about 2 months, depending on nail length, of your health and nutrition patterns. Puffiness. Is it water or is it fat, right? So they'll feel, oh, it feels like edema because if I press, right, it kind of dents and then the water goes back. But if it's fat, right, it's going to feel firm. So why might you have puffiness due to water? You're retaining it. So too much salt maybe, right? Too much hormones telling you to hold on to water? Is it congestive heart failure that's causing water retention? What's going to cause extra fat in the head? What's that? Not eating healthy, so you're gaining weight, or it could be a hormone problem, a thyroid condition, or a adrenaline condition that causes fat to go to the face. So you get a moon face or a buffalo hump, could be hormonal. Right? So that's the thyroid. Right? They'll check in your neck. They'll feel the nodes, see if they're swollen or not. Eyes, so they'll detect pupils, light response. And this is what the police officers do when they're checking. If they pull you over, they're checking for impairedness, usually due to substances. And it's how your eyes and your pupils will respond. So what they do is they'll make you move your eyes when they hand your license back. They'll make it cross your vision because most people are right-handed. So when they hand it back to you, they hand it past your left eye, past your right eye, and you're going to follow that license, and they're watching your eyes and the pattern of the eyes and the pupils. So just close your eyes next time a cop pulls you over, I guess. Ears, of course, we'll test for sound with the pitchfork. Check the structures for any wax that build up. Nose and sinuses. So we just passed allergy season, right? So spring for us, and also for us in the fall, when everything starts to get dry in this area, allergies will spike as well. Mouth and throat, overall health, swellingness, they'll check your teeth and then refer you to a dentist. What happens in hyperventilation? What happens to the CO2 level?
You don't have enough.
CO2? Hyperventilation. Yeah,
Oh, you have too much.
you're right. When you hyperventilate, you get too much oxygen.
Yeah.
Right?
I'm right.
You're right. But our body cannot detect oxygen levels. There are no O2 sensors in our body. Our body can only detect CO2. So if you hyperventilate, like some kids when they cry, right, they go, right? So that's going to hyperventilate them. CO2 level is going to drop. Blood pH is going to go up. And then if it goes up enough, you'll pass out. They'll listen, do some percussions, check for fluid, check for response of the lungs. Heart, percussion for size. So within the chest, same thing as the lungs. If it's a hollow sound, normal size heart. If it's a dense sound, then that means the heart has taken up the entire cavity. And when it beats, there is no hollow space for a hollow sound. Normal heart will have plenty of space within the pericardium. You can hear valve sounds if there's any. Breasts. How often do you ladies do your self-examinations? Never? Bad. You failed 12 times this month. No, 12 times this year. You're supposed to do it monthly, right? Do you guys know how to do it? Just touch? What position?
On your back.
No, not on your back, ladies. So Two positions. One is your arm down to your side. All right, and you're gonna palpate. What are you feeling for?
Lumps.
What?
Lumps.
Lumps. What should the lumps feel like?
Like hard rocks.
Exactly, very good. Pea size, and it has to be firm. If you have fibroids, then they're gonna be soft, and you're always gonna have those breast changes, right? So firm, hand down, palpate, and then your hand to the back, right? Arm to the back, and then palpate. Also check the contour because the cancer center will be tight and it'll start to pull the tissue together. So if your contour isn't symmetrical or if it isn't nice and smooth, that could be a sign of that contracting cancer. So how often should you be touching yourselves?
Every month.
It's okay. I asked the Pope if you have religious problems. The Pope said it was okay. Abdomen. So we'll listen for sounds, and that is high pitch or low pitch sounds in the gut.
High pitch.
Yep. You're going to get squeaking sounds, farting sounds, right? Like a balloon letting out air. So it's going to be high. So use the bell or the diaphragm?
The bell.
The bell. So the bell may be better, but sometimes the diaphragm might pick up the sounds better. This is very important after a barium enema. Do you know what that is? Barium is a metal, a heavy metal. So if they're looking at their intestines, they might drink the barium or they might infuse it, and it's going to go into the bowels, and then they'll take the picture, and you have to listen for sounds. You have to listen for like 10-15 minutes to make sure that they pass it, or it's going to be passing, because if it doesn't, it's metal, right? That powder metal is going to solidify, and they're going to have like a blockage in their bowels. So you have to listen and know what you're listening for. Very important. If you don't chart it, it's not in the chart, you didn't hear sounds, you killed your patient. Landmark. All right, female genitalia, similar to the lithotomy. Again, the table or the patient should be positioned at the edge, so the table should end there. This image just have the table extremely long. So for the PNP, what's a PNP? Pelvic and how often should you ladies have your PNP? Pelvic and pap smear.
Isn't it like every 2 years? Every 2 or 3 years? Yeah.
Yeah, so it depends on your insurance, because supposedly Obamacare said free preventative, and this is preventative. But at age 18 or when you're sexually active, depending on if it's in the family, there's HPV around, so if you have the vaccination or not, then they said every year. But
I tried doing it every year, and they're like, oh, you had it last year. I'm like, yeah,
but the insurance might only pay for it every other year. So what Obamacare was trying to get it every year, because hey, if I missed it 48 months ago, that means the cancer was growing 48 months until we caught it, right? So hopefully that portion of Obamacare still stays. Male genitalia. Men, how often should you be handling your testes? Men.
I said once a month.
Yeah, same, once a month. So how do you do it?
It says you wait after a warm shower.
Uh-huh.
And then you like roll it between your fingers
Firm.
and your thumb.
Yep, firm pressure.
Yeah.
What are we feeling for?
You're feeling for lumps.
The same. So if it's firm, pea size, and again, it's okay to touch yourself for this examination.
And then you're supposed to feel for the cord or something.
Oh yeah, the not the cord, but the pendulum.
Yeah.
So that's going to be blood vessels.
Yeah.
Right.
Supposed to line up or something.
Yeah.
It's supposed to be like a cord.
Because you don't want it to torsion. If it twists, it's going to cut off blood supply, nerves, and then death. In frocks, it dies and you lost. So that's a medical emergency. Get him to the hospital quickly. Right? And then if they lost a testy, then they'll take the other one and they'll sew it in place so it never happens to them again. Yeah, you're fine. You might need some supplemental hormones, right? Because now you got a bunch of estrogen and there's no testosterone to balance it out. So you might just have to get testosterone. So, men with testicular cancer that had to get them removed. Do you ever watch Fight Club? No, you should watch it because they have a support group. It's a fictional movie, but it's funny.
What
But
about
the groin,
Yeah.
well, what they're checking for is the coughing, right? So why do they cup the testes, have you turn your head and cough if you're a male?
See if they jump.
See if they jump. Why? If they
I don't
jump, if
know.
the testes move, what is that the sign of?
That it's connected.
It's connected to the inguinal canal, right? So men have a weak spot in their abdomen because we all start out as little girls with ovaries, and then we develop testes. If we're men, they come out of the abdominal cavity through the inguinal canal. So here you got that pendulum, that same cord, and if there's intestines sticking out and you cough, the pressure of your abdomen changes. It might move the inguinal canal if there's a hernia, and then pull on the pendulum of the testes and move the testes. So they're checking.
It's supposed to move.
Not supposed to move.
It is not supposed
They're
to move.
checking for a hernia.
Oh.
Because if there's a hernia, then
Mhm.
every time you cough and you move your chest cavity or your abdominal cavity, it's going to pull on the vas deferens, right? And the testes move. Why do they have you turn your head? Because if you cough with your head straight, you cough right on them, right? Okay, so I think that was a Seinfeld joke I picked up over the years. Digital examination. So men, how often should you get your proctal examination, digital examination? 40 years plus.
Oh yeah.
I think it's better because of BPH, right? Benign prostatic hyperplasia. Do you guys remember what the doctor's looking for? So they're looking for symmetry, because if one side's bigger than the other, cancer. If it's both sides is big or they're symmetrical, most likely BPH. So they're palpating for this texture here, the same, right between your index finger and thumb. So that's the texture of the prostate. And if it feels like your nose, that firm, then it might be cancerous. What is occult?
Hidden blood.
Hidden blood. So you might have to do a smear and then test for blood in the stools. Scoliosis is easy. How do you check for scoliosis? No, 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 no. You don't say those terms. What do you say instead? You never want to say bend over. You're going to say
Touch your toes.
lean
Oh, lean
forward. Okay, you're going to have to change your vocabulary. Yeah. Yeah, we're not in the clubs, so make sure you have the patient lean forward. You can say bend at the waist, right? Bend at the waist, but never say over.
Bend over.
Never say over. Gait is how you walk. So your posture while you walk. This can signify a lot of neurological damage or problems. In Parkinson's, right? How do people with Parkinson's walk?
Like,
They kind of shuffle
yeah,
and,
they do.
and then they shake, right? So if your patient starts to exhibit those characteristics in their gait, then check now for Parkinson's, right? Range of motion, of course, muscle strength. So remember, we lose muscle about 1% per year, so 10% per decade as we age, the elderly age. So the strength is pretty much the same. It's just there's less muscle and they work a lot slower. So for elderly patients, have them build muscle, and to prevent falls, have them walk and pick up their legs. All right, every day I'm not shuffling, because if they shuffle their feet, they trip over stuff and tend to fall. So have them making the habit of taking steps. Reflexes for your nerves. So with the hammer, cross your legs, bump your knee, cross your
Cross
arms.
your legs.
Yeah, at the knee, right here. And then they hit your knee. They never checked your reflex?
Cross it.
They just do it like this and they hang it?
Yeah.
Okay, so wherever, just relax, yeah. And then they'll hit it. And then I think it was cross the arms, yeah. Cross your arms and then they'll check your elbow and the nerves in your abdomen as well.
So that is true, like sometimes like when someone scares you and then you just hit them, it's really just your reflexes.
Yeah. It can be, yeah. Yeah. So if the person gets startled enough, yeah, you'll get a reflex response. So that's a flood of adrenaline. For some people, it's quicker than others. So if you're a Navy SEAL and a bomb goes off, you're calm because even though you have that flood of adrenaline, you're already used to it. You know what that feeling is, right? Your body starts to sweat. They already know, oh, and they can still function. Or they just enter into flow state. Seating position, a system, up and down. And then if you did a procedure and lubrication was involved, you may want to hand them a tissue so they can clean themselves, right? Don't wait until they ask. And then let them dress. You can exit the room at that point. And then any other test, ask them before they leave. There's prior to dressing. All right. So we'll apply bandages. We're almost done here. We'll look at some videos and we'll do some bandages from head to toe. After dressing, we do the urine strip and then pulmonary tests. You guys know what that's called? Spirometry, right? So the lung capacity test. So spiro is just breath and meters to measure. And then the patient education before they leave. Follow up. So before they leave, set an appointment, and usually the receptionist will reaffirm it. Fill out their card at that time as well. For outside appointments, what's the most important thing you should check? Yeah, if the insurance will be covered. So if you send them to go get a specialized x-ray or see a specialist, just double check before you send them. The insurance will cover it. How long does Medicare cover nursing home stays?
5 years.
Less. Per facility, I think it's like only like 2 weeks, and then you have to go to a different facility because they don't want fraud to happen, because you can collect a bunch of these patients, say they've been here forever and ever, and because they're not moved to a new facility, because when you move a new patient, you have to do the new patient intake, right? So they only cover a short term, so the patient gets that new intake every time they're admitted to a new facility. So that's one of those weird caveats of dealing with Medicare. All right, not too bad. Let's go ahead and take a break, and then we'll do bandaging in lab.